Thank you very much, Mr. Chairman, Ranking Member. Really appreciate the opportunity to be here today, and thank you to all of you for all the work you're doing. Mr. Secretary, I wanted to start with you, and I wanted to talk about coronavirus. My home state of Washington is really an epicenter of this right now, but it's coming to everyone. In my state, there's now been 24 deaths. It's counting, and the number of people we're not even saying anymore because it's growing so much. This is really a serious crisis, and every government entity has to be equipped for a comprehensive response. It's not something we can do on the fly or last minute. We have to be prepared. We have to be prepared now, and frankly, the lack of preparedness I've seen from a number of federal officials is really disconcerting to me. So I wanted to ask you today how you are assuring sailors and their families who are stationed in my state and really across the country and around the world now, how is the Navy prepared to deal with this virus as it continues to grow?
So thanks, Senator, for the question, because it's obviously a top of mind right now for all of us. We at the Department of Defense, we've been engaged on this since probably the second week of January in terms of how we can assist, how the Navy can assist. And in the initial phases of this, we opened up Miramar Marine Corps Air Station for patients that were there in quarantine for a couple of weeks. We've done it again now for another 300 coming off the cruise ship. So we've been engaged in the interagency. In terms of our own process for our own people, we have been very communicative with them in terms of what they need to be doing. We're passing along all of the basic measures that the CDC
to your military bases.
To our military bases, exactly. And the Secretary of Defense, I believe, last night signed out something, I hadn't seen it yet, that basically puts out some mandates for personnel moves, et cetera, to the various countries, in and out of various countries. We were waiting for that to follow on his guidance so that we can flow the same guidance down to our folks as well. So we are very engaged in this. It's a big part of what I do every day.
Do you have a plan for testing availability, for isolation, for anything that beyond just it's coming to you?
All the individual bases are going through that process in terms of how they would handle it on their individual bases. Some of them have unique circumstances, like the Naval Academy, for example. All of our midshipmen are on spring break right now. And so we stop them from going to certain countries for spring break, but they're coming back here at the end of this week. The superintendent there has already set up facilities there if we need to do isolation for those and testing for people who have symptoms. They're going to do a very extensive interview and when every midshipman comes back to ask them, where have you been, who did you speak with, all those types of things. So each base is doing different things depending on the population that they're dealing with.
Are you talking to them about social distancing? Are you talking about?
Yes, ma'am. All that type of guidance has gone out. I've already put out I put out a vector message to the fleet every Friday. I've already done that twice in the last couple of weeks in terms of guidance.
And what about protective equipment? Do you have what you need?
I'm going to turn that to CNO. I don't know if you have an answer to that one.
We do have protective equipment in terms of, we would prioritize
gloves,
the issuance.
Masks,
prioritize the issuance of it. I think, ma'am, with the absence of a vaccine, and then we do have testing. We do have facilities that actually can conduct a test for us. But as you know, nationally, we're trying to increase the amount of testing kits that we distribute. And so until we do that, we're really trying to minimize the risk of anybody contracting it and then transmitting it. And so we've taken a number of steps, as Secretary Moodley just mentioned. And the Secretary of Defense, I expect, will come out with top-down guidance today. The Joint Chiefs just met a day and a half ago and provided him our best advice. And so I would expect that we will see even more top-down guidance today.
Okay. Can that guidance be shared with us?
I'm sure it'll be public, ma'am.
Okay.
There's no reason why it wouldn't.
Do you have the resources you need to deal with this?
I think right now we have the resources that we need to deal with it. We have not seen significant outbreaks anywhere in our force. I think right now, we only have 2 or 3 people in the service that have tested positive. So I think we're okay right now, but that may change.
I understand that DOD has started to shut down some of the schools and child care centers that are on the installations. That obviously places a burden on families. How are you dealing with that?
Well, with respect to that's another thing that's come up to the individual commanders to make that decision as to whether or not they want to do it. I know with respect to the schools, they're looking at ways to possibly do school for those students. But
I would suggest that all of your schools be ready with a plan should they have to shut down, with how they can do online learning, how they deal with childcare, how they deal with nutrition, all of those things. In my state, they're doing that seat of the pants, and having a plan in place for that ahead of time would be really important for all of your childcare centers, schools. And any other information you can get us on that, obviously.
Ma'am, so we're actually doing that right now in some locations with virtual training. We have a plan at the Naval Academy in case, a worst case plan, we'd have to stop classes. And so the graduating class, we would be in a place where we could actually graduate them on time or even early if we had to. And so we are looking at that. In terms of shutting down schools and child care centers, we're doing that in a case basis. We're trying to ensure that we're stitched with the local communities as well, so that we're not out of sync. And so that's an important consideration.
Okay, great. Thank you very much. Appreciate it.